Where he is. Okay. So, ladies and gentlemen, good morning. And welcome to the Small Business Association, our monthly sensitization session, where today we will be looking at COVID-19 and the implications for the small business community. I'm very pleased today to have Dr. Eustace Gabriel, who is the PAHO WHO representative here in Barbados, and he is going to make our presentation today. Let me share a little bit about him before we begin. This is a very competent individual. Dr. Gabriel is the representative for Barbados, the Eastern Caribbean, the United Kingdom overseas territories of Anguilla, British Virgin Islands, and Montserrat, as well as the French departments of Guadeloupe, Martinique, and French Guyana. Dr. Gabriel is a national of Jamaica. He is an epidemiologist and a preventive medicine specialist with 24 years of public health leadership and management experience. He has worked with health teams and national officials in the Bahamas, Jamaica, Suriname, Trinidad and Tobago, and in 12 Eastern Caribbean countries, where he helped to increase utilization of health services, eliminate barriers to access, reduce health inequalities, and improve health outcomes. He joined the Pan American Health Organization in 2005 as an advisor, disease prevention and control in the Bahamas country office. He's also served as advisor, family health and disease management in Trinidad and Tobago, and as a sub-regional advisor, HIV, STI, tuberculosis, and viral hepatitis at the sub-regional program coordination office here in Barbados. And since 2016, he has served as the PAHO WHO representative in Suriname. Now, from all of this, you'll realize that this is a very competent individual. I've not even read the entire bio for you as yet. All right? But let me also share that Dr. Gabriel obtained a degree in medicine, a master's degree in public health with an emphasis on infectious diseases, and a Master of Science degree in occupational health and industrial hygiene from McGill University in Montreal, Canada. He completed his residency training and fellowship in community medicine at McGill University, the Montreal General and Montreal Children Teaching Hospitals. So, as I indicated before, with all that is happening around us today, as you know, the World Health Organization would have declared the coronavirus a global pandemic. And here in Barbados, just this week, we have had our first confirmed cases, imported cases onto the island. And therefore, as you can imagine, there is some panic out there, but we have a responsibility as leaders in the small business sector to bring to you, the members, and to our stakeholders, the facts, the evidence, so that you would be informed what are the implications for your businesses. We are of the view in the SBA that the micro and small business community is a vulnerable group and will be impacted severely by the economic fallout from this pandemic. And so today, as I mentioned before, we will be conducting a short survey that will help us to improve our lobbying, that will help us to collect critical information, that as we speak, we can speak from a position of research as we call for the relevant support for this sector during this time. So I want to thank you again for your cooperation in helping us with the survey today. and for you being here. And at this time, let me invite Dr. Eustace Gabriel, who is the representative here in Barbados for the Pan American Health Organization and World Health Organization. Let's welcome him as he comes.
Good morning. Senator Holder, Chief Executive Officer of the Small Business Association. Ladies and gentlemen, it's my pleasure to be here this morning, and then thank you for being here. Actually, this is your commitment to listen to this important message. If you have a pen, a pencil, or a white paper, please write down Corona. C-O-R-N-O-A, Corona. So, C-O-R-O-N-A. All right? So, for the C, clean your hands. For the O, off from gathering. Off from gathering. For R, raise your immunity. You don't have to write it. By the end of this session, you should be able to say it. For O, only sick people wear masks. For N, no handshakes. And then for A, avoid rumors. All right, so with this, I will start my presentation. If we can have, I'll go from here. As the business leaders and business owners, you are facing an important decision at this point in time. The first thing is that any epidemic, any pandemic, if we work together, if we are prepared for as a business people, the first thing at this point in time you're going to look at is that you have to manage and then build resilience, and then during this period, and also it is an economic crisis. For the public health crisis, it affects all of us, and then it challenges the health system. However, when we say the health system, it also takes into consideration the social fabric of our society will be challenged. At the same time, it is also an economic crisis, as you have heard and learned all over the world what's going on right now. I have a good news this morning. China is in China. That is a good news. They have only now imported cases. That's what the report says. On the other hand, Singapore a very good country with business, but known. And also Korea, South Korea, have turned the outbreaks. The numbers are going down. So those are good news. We have to share. I don't know if you could see very well this because of the light, but what I can. Those are number of individuals affected in China. As the time goes by, this is somewhere from February 1st, if you go and then look at the blue bar chart, the number of cases in China start to dissipate and decline. On the other hand, on the far left side, or your right, you see the green. Those are, from February on, it's increasing. That's the rest of the world. So we have traded in terms of the outbreak when more countries and more people being affected, and China has turned the epidemic, as you see. So action by governments, action by people, action by health workers could turn the epidemic now, which is a pandemic. Just to bring you to our area, which is Americas, Barbados included, the Caribbean and others, all of those countries have reported, most of the countries actually reported. The larger number of cases so far reported is from United States, Canada, Brazil, Chile, Panama. But when it comes to the whole region, 39 countries have at least reported one or more cases. Still in our region, in the Americas, 18 countries or territories never have any cases. 18 countries or territories, they don't have any cases. So, did they do something different than the other countries? That's not the case at this point in time. The virus would reach all shores. What is important is that how do we respond to it, and then how do we come above this situation in a short period of time. So, whether it is one or two cases or plenty cases, the response has to be to suppress and control the epidemics. Outbreaks here, outbreaks there, in each of those countries, we have to stop it. In order to do that, once we identify a case, a person who is infected, we have to isolate that person. We have to test that person. We have to treat that person. And then we have to trace the contacts of that person. Since last Tuesday, the Ministry of Health in Barbados and then officials are doing that. And before that, they've been doing the same thing. That's how we stop this outbreak. But not, remember the one I told you about the corona, the A, not about rumors and fake news. So we have to work together to meet those things. Why we have to test and treat, isolate and track and trace? Patients with COVID actually could also shed the virus 24 hours to 48 hours before they become symptomatic. Some of them. It's not all of them. It's maybe 1% to 3%. That's one thing we have to look at. Those individuals also being infected, to some extent, they could also continue to have symptoms and then spread even after 2 weeks of treatment, up to 3 to 4 weeks, they can shed the virus. Therefore, it's important when health officials say, we have to isolate you, we have to take you out from certain mass gathering. That's what we have to follow the public health officials. So, if we have this kind of problem where the virus could be circulating from infected person to an susceptible person, where is the most important work to start? The most important work to start is in the health services. It's not because I'm a physician and then that's my life work. It's because the reality of this disease to be stopped not only by the whole society, but when we have a rationale for providing care for people who are sick. This graph shows you an important aspect of why we have to act effectively, rapidly. Look at the first part, which is the green one. That is when we don't have measures in place, we're going to have a lot of cases in a short period of time. This graph shows you that. Here, what we want to do is to flatten this curve, the blue one, just like that. The green one, to make it like the blue one. That will give us time to care for all people who are sick. If in a short period of time we have 30, 40, 50, 100 people infected and then come to health services, the health system will be overwhelmed. But we can still have 30, 50, 100 people infected, but if they are coming over time, the health system, the healthcare workers, our other systems continue to function. So that's where preparedness and then all society has to come to work. If we don't, how do we do this, flatten the curve? We have to work together. It is not only the health sector. We have to do certain measures about social distancing, tracing, isolation, quarantine. When people have been quarantined, they have to follow those things. Otherwise, we cannot flatten the curve. So that's what it means. For this, we can also reduce death. So the more people come in a short period of time, the health system cannot be able to cope. We will not have enough facilities to treat people. So, going back to the same curve I showed you, the blue side is China. The other side is outside of China. The China curve picked up. If you have seen the country, especially Hubei, Wuhan, that's where a lot of cases came the first time, the first months. Now they could spread over time and then manage more cases. Over time, it has reduced. Similar things we have seen in Korea. So, if we have more cases, what does that mean to all of us? The first thing is that COVID, the viral infection, about 80% of, 8 out of 10 are between mild to moderate clinically. 40% is totally mild, little bit of fever, aches, and the person manages day-to-day activity, but has to be at home in this particular case. Once it's diagnosed, it depends how the healthcare workers, health official manage such a person. The other 40% may have lung infections, as pneumonia. That could be also managed in different ways. But on the top one, 15% may have, 1 out of 7 may have severe infection. They may need oxygen because the lungs are not able to function properly. And the 5%, 1 out of 20, would have mechanical ventilation. They need respirators, ventilators in the hospital. They will have to be admitted and they need ventilators. So when we look at this, the impact in our society, at least we have to estimate 20% of the population may need hospital care. So look what it means for those countries. These are just estimates. Italy has now almost 30-something thousand cases. They may need at least 5,500 oxygen and ventilation. The same thing goes to Iran, Spain, Republic of Korea, and Germany. With the number of cases, there must be services available. So that's what we wanted to reduce when we flatten the curve. I'm going to pass this one because the issue is the same. But if we have now just few cases, about 21 cases, let's say we have 21 cases today, and then 5 new cases appears, the scenario is that if one person infected is able to infect 2 to 3 people or maximum 5 people, how do we reproduce this kind of infection over time in our society? One person infecting 2 people or 3 persons. With that, when we have a lot of infections, each person infecting others, on a daily basis, the demand for hospital beds, the demand for admission increases. So these are the things we have to look at from this graph, this table shortly. Here, what happened? When you have this surge of cases coming over time, the health system will be actually overwhelmed. Look, and what time we have to respond. A case appeared in March. Within 2 weeks, the number of deaths has skyrocketed. Why? We don't have much time to respond. So the preparedness time is before the cases appear. That's what we have to do, and then we have to work. That's why you as the business leaders, also do have that responsibility to work with your work employees and also with the healthcare officials. The health system have to work differently. They are preparing everybody right now. There could be some triaging where individuals have to come for the first screening, where they have to go, and then who to call. All this is part of the preparedness, and we have to follow those things and then comply as much as possible to make their works of the health officials easier. Believe me, it is not easy. They are working 24 hours 7. We need also space and supplies. The ventilators, the masks, the gloves, whatever they need to work has to be stored or has to come from outside. So if we close our borders to some extent, we may not also get those supplies. So that's another thing we have to look at. I'm not saying don't close the borders, but these are the cases we have to do. Actually, from Pan American Health Organization, World Health Organization, our recommendation is that do not limit or restrict travel and trade. That's what it is. However, countries are able to make their sovereign decision and then what is applicable at the time of the outbreak. So if there is an escalating outbreak, they can take certain actions, and then why they are taking those actions has to be very clear in keeping with the national situation. We have to continue protecting healthcare workers. If more and more healthcare workers get infected, who's going to take care of you? Who's going to take care of us? So we have to make sure that the healthcare workers are protected, they have the necessary supplies and then protective equipment to provide care for all those who are sick. This graph will show you, again, 1 month's difference between what China went through, the People's Republic of China, and then what the rest of the world has gone through. The reverse. So we have time to act. Still, we can act and then reverse the outbreak. Especially in Barbados, what we have is just 2 imported cases. We can continue in the preparation. We are still in the preparedness form. The government have the national plan. We have to follow those national plan. So let me give you now a bit of science, which you may be interested. How do we get COVID infection? The first one is that it is respiratory illness. It's a virus, person-to-person transmission now. And then by respiratory, and then the other one is by contact. Respiratory droplets are the source of this infection, meaning when a sick person coughs, sneezes, the virus leaves or shed from that person. So if you are in the vicinity of this person, which is less than 1 meter or 3 feet, then we can't be taking in these droplets. The second one is when the same person is coughing and sneezing, the sneeze, the cough, and whatever comes from this person may drop on surfaces. It could be your desk, it could be your table, it could be the door, the person might touch his face, it could be anywhere, and then you're going to touch those surfaces, and then you touch your face, nose, eyes, then the virus goes in. So those are droplets and they're respiratory. There are some people may have said, can we get the infection through the air conditioning or coming? It is not airborne. It is by droplet. The person coughs, the virus doesn't suspend in the air for too long. The moment it is heavy virus, just it drops. Therefore, if somebody was sick in this room, has coughed, and then we came back later, we'll not be getting it from there. However, if that person has coughed and then touched this computer and things like that, or this microphone, then I'm touching it and then touch my face, that's what there will be the contact. Okay? So this is the situation. There are other areas which people started to learn more. We are trying to learn more about each day about the virus characteristics from the studies from other countries. From China studies, that's China medical experts are publishing on a daily basis their observation. That's what we are sharing. And then we have also a WHO team went to China and then did an assessment. And then we have some knowledge what's happening in that country. Other countries now started also to share and then publish medical research. We have to follow those medical research as long as they are evidence-based. So that's what we are sharing here. So when it comes to the virus transmission dynamics, I want you to know that it is close contact one of the areas where the virus thrives in the transmission. Close contacts meaning that a household, if I am infected in my household, my family would be the first one to be receiving those viruses because we have that close contact. However, anybody who may have been in contact within 1 meter of me, this is more than 1 meter, so you are safe today. But if I am sick, if somebody is sick, that is the distance we wanted to make sure. That's part of the social distancing we are looking at. So 75, 7 out of 10, 8 out of 10, the clusters are in the family. Okay? So the transmission also could take place in nursing homes, in restaurants, it could take place in bars and other places, in hospitals too. What we have to do is continue to have these infection prevention and control mechanisms as much as possible, which we're going to discuss with you a little bit later. The natural history of this virus, to add, is that from exposure, meaning that from the day I got this virus to get symptoms, on average is 5 to 6 days. Okay? The symptoms are cough, fever, running nose, shortness of breath, and difficulty breathing. Those are the symptoms. And body aches. From symptoms to recover, if you have a mild illness, is about 2 weeks. And then from severe cases, this may be a little bit longer, about 3 to 6 weeks. The last one is that from the symptoms starting, those who are critical, what is the percentage would be critical? Only 5%. 1 out of 20 will have that critical illness. So for those who are critical, maybe in 1 week, unfortunately, they may die. This is just few percentage of those cases. And then that in some instances, it may be as long as 2 to 8 weeks. So truly, the asymptomatic infection could take place, but it is very, very rare, because people are able to share the virus before they have the symptoms. Just 1%, maximum to 3%. 1 out of 100 or 3 out of 100 people. So we will not be worried about asymptomatic transmission, but we have to be worried more symptomatic people transmitting the disease. Okay, let me take you back in this. We have shifted now. In Barbados, we were no cases until the last week, the weekend, and then now we have 1 or more cases. We have 2 cases. So what does that mean? Our aim, still we have to continue to prepare. Okay, we have to prepare, continue to prepare as much as possible to stop the transmission and prevent the spread. That's what we have to do. This is the message from this slide. The same thing, no cases, now we have sporadic 2 cases imported, and then if we have clusters from those, because there is contact with people, it could be 0, it could be 1, we don't know. We have to wait the next few weeks, up to 14 days, we have to find out if we have any cases coming from this. The officials were able to take these 2 immediately and isolate them. That's how we're going to continue. Isolate, test, treat, track. That's how we're going to do, so as much as possible. Therefore, we can manage the outbreak. By the way, we have an outbreak in Barbados. 1 case of COVID is an outbreak because we never had COVID before. All right? So we are here, we are with it now, right now, but we can't manage it. That is the point you have to take into consideration. So is it possible, some of the facts we may need to know, it's also possible people for any age to be infected. That's the most important. Any age to be infected. Infection doesn't have a risk in terms of you are at a higher risk for infection, I am the less risk. Everybody's at risk for infection. Everybody could be infected. The next point is that people with pre-existing medical conditions like hypertension, diabetes, heart disease, lung disease are more at risk for severe illness. You see the difference? The risk increases for severity of the illness with other. That's the risk we are talking about. If you are healthcare workers, if you are coming in contact with somebody every day, and then you are not wearing your mask or washing your hands or something like that, you are at a greater risk. That's different. Older adults are more at risk of severe disease. The 15% we are talking about. Risk of severe COVID disease gradually increase with age. We start somewhere over the age of 40 years. However, the critical and very severe lung diseases will be over the age of 70 and 80. Thus, with increasing age, there is an increased risk of severity. Are we clear? Wonderful. So, do we have treatment? We don't have specific treatment. Once I have COVID, okay, this is what I'm going to get for treatment. No. What we have is supportive treatment to alleviate the different symptoms. So the doctors in the hospitals or the news facilities do know what to be given for individuals when they have those cases. However, we don't have any specific antibiotics we cannot use or certain medication we cannot use, because if you have high blood pressure, for instance, you take high blood pressure medication and it reduces you, or diabetes, you're going to reduce. But for COVID, we don't have such a treatment. So everything what we do and treat is the symptoms. So, workplace, the last few slides. What can you do in your workplace? The first thing is that if this is a respiratory illness, and if this is transmitted, since this is transmitted by contact, and then respiratory hygiene, and then hygiene in general would be a preventive measure. So your surfaces, if you have your office or business which is related to catering for customers, and objects, whatever you have, has to be clean and wiped as much as possible for both your staff and for the client and customer. And then it has to be disinfected regularly. Not just a piece of cloth and then just wiping, but properly disinfect using disinfectants. Why? Because contamination on surfaces, I mentioned to you earlier, touched by employees and customers is one of the main ways that COVID could spread. Are we clear? Excellent. The second is that as business owners, and then part of these prevention measures, you have to promote hand hygiene. Hand hygiene, if you are a facility where customers or employees, whatever number of employees you may have, we have to provide hand rub dispensers there, prominent places, not to be hidden somewhere and then when somebody comes, it has to be easier and accessible. And then they are refilled. Sometimes it's dried out. I know there is some shortage in some places right now, but we have to try as much as possible. If you don't have those things, what will be the other measure? Washing hands with soap and water. So we have to provide washing facilities for those visitors we may have or employees we have working with us. So make sure that staff, contractors, customers have access to places where they should wash their hands. That's very critical. And the water is adequate and appropriate for the hand washing. Why? Washing your hands kills the virus, COVID virus, on your hands and prevent the spread. That's a very important message. That's why our message is that wash your hand, have been so many times been said. All right, you remember in the corona? The first one in C was clean your hands. Clean your hands. The respiratory hygiene is another thing which you can implement in your workplace to promote good respiratory hygiene in the workplace. If you are able to do it, for instance, when I came to this office, there was posters, small posters, they have printed it and then put there what they have to do. Combine this with other communication materials if you are able to do so. And briefing, if you have meetings with staff, most of you may have 5, 10, or I don't know how many employees you have. If you have regular meetings, just add 1 or 2 words about it. I think this is what the CEO, the Honorable Senator, has done in this meeting. Create the environment to learn about it as much as possible for your employees and customers. Here is one of the issues. I just mentioned before about masks. Masks are for people who are ill. Masks are for healthcare workers or respirators and other for healthcare workers to protect themselves from infection, and then the other person also not to spread the infection. So masks and paper tissues are available at your workplace. Make sure that you have that for one reason. Your worker, your employee, or yourself, you can work and then start to sneeze and cough and then running nose. So until you go somewhere in the workplace, maybe you can use that one, and then unless you have allergies or something like that, we are going into this outbreak, not now. But if we have an outbreak, we have to continue to prepare ourselves. Please do not use masks on a daily basis, walking around and putting under your nose or something, under your neck or on your head. So I have seen people doing those kind of things. I don't know why. Actually, it gives you a false sense of security. You tie those masks and then put your face in, and how long? For 8 hours, 10 hours? Therefore, it may put you at risk if you are wearing masks unnecessarily. It's not also combined with hand hygiene. You may wear masks for reasons, but when you do that, also remember to wash hands and then continue to observe. Good respiratory hygiene prevents the spread of COVID. Therefore, people have to know how to sneeze, how to cough, sneeze especially in the creaks of the elbow as much as possible. If you have tissue, clean up your nose or mouth and then throw them appropriately. Not just and then wash your hands after all of these things. So that's what you have to tell also your employees, and then also your customers when they come to your premises. So, as business owners, Senator, what I could propose is that keep yourself informed. Your employees are informed about COVID. That's what you did this morning. Stay in touch with your customers. If you are the business, you have to inform your business to your customers how you're going to provide them those services as much as possible. So you have to design your workplace plans, prepare customer and business plan. I cannot just speak with you. I can speak later on one-to-one, but if depending on the type of services you are providing, the type of business you have, it's important to have a business plan to some extent. Try hosting online events if you have you are a small employer and then you have possibilities of inviting your customers online. Use the media, whether it is in Facebook or whatever. I think small businesses do have Facebook, Instagram. You can reach your Snapchat and others, so you can use any of those mechanisms. Sometimes you can prepare frequently asked questions. I don't want to go into the details of your industries. For instance, if you have a parlor, where a barber shop and things like that, is it safe to come to a barber shop? You can have an FAQ, frequently asked questions, how you wanted to make sure the services are given to your customers. I think this is my last slide. COVID is a new disease. Never been in our human beings have been infected by COVID before, COVID-19. Coronavirus, we have coronaviruses in animals and humans before. We have flu kind of common cold from coronavirus, different one. This is a new one, a new virus. So that's why we have limited understanding yet. But we are learning more and more from the scientists, the medical doctors and others from other places. It's emerging and spreading. So there are some more confusions. And then the time is different. 30 years ago, when we didn't have those social media, we would not have heard much of what we are hearing right now, right? So some people just get excited about those kind of things and then say something which is nonsense to help no one. Therefore, remember the last one, A was avoid rumor. So you have to fight back on fake news as much as possible. And then there is some fear. It's understandable. People will be infected, people will stay home, people may not be earning money. There are so many things. You have families. So it's understandable. However, we should be able to prepare ourselves and then what will be our plans to respond to this outbreak. I thank you very much.
Excellent presentation, Doctor. My name is Dr. Donna Matthew. My company is Caribbean Weight Loss Clinic and Spa. My question in the presentation where you spoke about treatment, I have two questions. I'll pose the first one now. The treatment I saw in the research, chloroquine, an anti-malarial being used in some of the developed countries as treatment for coronavirus. I want your opinion on that. I know with medicine we have trials and we have to go through, trials before we actually start medication. But I had seen chloroquine, which is, as I said, an anti-malarial being used in the treatment. So I want you to comment on that. And then my second question is, Jamaica has up to date about 12 cases, Barbados has 2, Trinidad and Tobago has 5. And my question is, do you think it would make sense for us in the region to band together to prevent the spread of this pandemic?
Okay. Thank you very much for that question, Doc. The first thing is that on treatment, as I mentioned, there is no specific treatment. However, as you mentioned, there are almost about over 200 trials. So countries are using different methods. Antiviral medication, which are used for hepatitis, for HIV. They also used chloroquine, which is used for malaria treatment. So they are trying to find what would be the best way. In some instances, if it has reduced the symptoms, or in some instances, if they have totally reduced the virus transmission or multiplication, there are different types of treatment trials is going on. So there is no any effective treatment. So they are also, including this one, the chloroquine, is not effectively shown to be managing COVID-19. However, what WHO has done is that for physicians and countries who are interested to be part of a trial, there is a website. Once you started to have cases and then you started to manage, you can recruit your patients to be part of that clinical trial. So as long as those clinical trials are accepting new intakes. Just this morning, one study was published, especially the use of antiviral, which is used for HIV medication, and then lopinavir. They said it was found to be not effective in treating COVID. So it's coming out with the different studies. There are other medicines being used, alpha interferon, beta interferon, which are also used for antiviral in the past, but none of them have been effective in treatment. So there are some trials. In terms of the countries to work together, through CARICOM and then CARPHA, the Caribbean Public Health Agency, and PAHO, we are working actually on a daily basis. Yesterday, our director of PAHO has invited the ministers of health of all Caribbeans, and then there was some dialogue. So where they are at and what are the issues, how we're going to support them. We provide test kits to the countries, including Barbados. We provide personal protective equipment for healthcare workers. We provide training on risk communication, training on surveillance. We have teams going to the countries and looking into their organization, health service organization, how many ICU beds they need, how many ventilators do they need. We also do some procurement. So we work together with the member states. It is going well, but still we have a window of opportunity to stop the transmission in the Caribbean.
Just as an addition, we can also use the social media, as you said, the different forums, Instagram, Facebook, Snapchat, to get the news out there. Avoid the false news. So only positive. WhatsApp as well is another forum where we could spread the information within the islands. And so that was just a suggestion. Recently in Italy, they're finding more persons, the younger, the millennials now with the COVID-19. Can you explain to us why that is, why you think perhaps?
Okay. Thank you for the advising about the social media. I encourage you, all of you, to go to our websites. We have a very good website and source of information. I think I must have earlier mentioned it somewhere. The PAHO website, WHO website. We have a COVID dedicated. We have information booklets and brochures which you can use for your sites. We have partnered with Facebook, Twitter, Instagram, WHO and PAHO. We put our messages in those platforms, and at the same time, they are also working for to reduce this fake news and then certain messages which are of counterproductive in terms of the information. Italy, where we have now exponentially increased both infection and mortality, they have done very aggressive methods for the last 2 weeks. So we have to see how that turn around the infection in the next 2 weeks. Okay. However, in some communities, in some villages, one of the villages is called Vo, where they have tested all the members. There are about 3,300 in one village, Vo, V-O. And then what they did was they test them again in 2 weeks' time. And the number of infection actually reduced in those communities. So the most important thing is that even though people may think that they are invisible, they may not be infected, and then may not listen to the quarantine. I think you have seen so many videos from Italy where people were singing for the healthcare workers actually in their homes being quarantined. That shows individuals are observing the quarantine sign. So some people may, by the way, when it is quarantine social distancing, there is also ways to give individuals time to go and then do their shopping. It's not just closing down the whole thing. So you can go to buy groceries, you can go to a restaurant and buy takeout and then go back. So as much as possible you have the social distancing. However, to some extent, life has to go on. It's not just totally closing down the whole thing. That's part of our life. Any more questions?
Okay. Good morning. My name is Kay Baptiste, and I manage a company called Ashes Complete Services, and we have one of the most important profession in everything. I would consider that we are third on the list after the government, the health official. We cater to the cleaning services of the environment. My question of comfort, I have brought out most of my staff members because we want to know, we want to understand, and we want to be safe. My reason for bringing up most of them today is so that they would have a better understanding. Most of all, they would be safe before we go out trying to conquer the world and we are unsafe. I would like, if you can, to speak to us, meaning staff and everything, some form of comfort. I am okay, but I don't know what they're feeling. What they're going through. If we have a call to go through, we will go through to go out there and work in that environment. Where PPE and all this different stuff is concerned, I made sure that I am covering my staff members. One thing is that I could not find sanitizer, so I came up with this idea where I bought lots of alcohol and
Gel?
Wet wipes,
Yeah.
wet wipes, and I would have poured the alcohol. And my intention is that when we are going out on jobs, I'm going to supply my staff members with what they need. In terms of working, the mask and so forth, one of my questions is that if we are called to a job where they suspect that there is a case, is it necessary, or would it be necessary to use the mask? Because I understand you said that the mask is for already people who are sick and health care workers. And anything else you can say to us when we go out there would be greatly appreciated. But before I finish, I just want to say thank you for the information. A lot of things that you have said came as clarification to me. I want to say thank you so much for SBA, not just for offering this forum, but free of cost, where I can bring so many. So I just want to say thank you. So.
Okay, thank you very much for that question and comments. I actually agree with you that the work of environmental sanitation workers is very important when it comes to protecting both the client and also the employees. When I mentioned about individuals not to wear masks, it is just for them considering to prevent infection just going on the road. But individuals who do have contacts with possible hazardous material, where environmental cleaning and others, they may have to use personal protective equipment, including gloves and masks as needed. How to use also is one area. The other one also, how to disinfect, how to wash this water, sanitation, and hand hygiene, especially for all of those individuals working in the environmental sanitation services. I will be very happy to bring together your teams and other environmental sanitation workers how to manage when it comes to cleaning or providing services, larger service areas, or small clients you may have. So please talk to me later on. We can arrange through the SBA for the environmental hygiene and sanitary workers as well. Yes, you are right. It's a very important area where the employees are protected and provided the necessary equipment. When you also manage in certain areas, for instance, where patients are, if you go, for instance, where patients are managed in homes or in institutions, how to manage, we have guidelines. I'll share that guideline as well. Thank you.
Okay, good morning. My name is Carlos from Miracle Bam. I guess maybe I could plug in the advertisement here. Well, we produce sinus rub in case you become congested throughout this period. We also have pain relieving products in case you have the money aches and pains or whatever. Hopefully none of us would contract this thing. However, there was a lot of hype in Barbados, or there is a lot of hype in Barbados in terms of using vitamin C. You go to try to get vitamin C, you can't find it. Some people say if we use vitamin C, this maybe if we use it in larger doses and stuff like that, maybe it can help you or stop you from prevent you from contracting the virus. What is your take on vitamin C? Should we use it to boost our immune system? Is it something viable that we should consider?
Thank you very much for that comment. I mentioned about boost your immune system. This is just like to live a healthy life, as you are healthy lifestyle. Individuals who are consuming additional vitamins may not have any different protection than any other person who is not taking vitamin or vitamin C or any of that nature. So we don't have any studies which show that taking vitamin C will protect you from COVID. That's the first thing. However, how do you build your immune system? To build immune system, the way we have been saying in the past is to eat the right type of foods, avoid fried food or unhealthy, high in sugar and carbohydrates and others, and then exercise, drink a lot of water, sleep well, more than 8 hours, 7 to 8 hours, as long as your time permits. Those kind of things are the one to continue, and then reduce stress. Those are the areas where you can build your immune system. Some people do have a lower immune system because of taking medication or radiation for cancer, or may have HIV. Those people may have a higher risk of chronic diseases, including severe COVID. So for that matter, we encourage people to build their immune system, but not necessarily with vitamin C, because we don't have any data about vitamin C.
Good morning. Eleanor Oxley, RE EnviroHealth International, and thanks again for the very informative session. But further to the lady from Ashra Complete Services, and we've been seeing a lot of this in our business where persons are saying, you know, we're purchasing PPE and we're using it. But one of the sad things is that they're purchasing it, but it's not being used correctly, especially the respiratory masks and so on. You must be shown, you must be trained how to fit the mask correctly. If not, you may end up doing more damage to yourself. So I just want to say that amidst all the information gathering, you should also look at having a session where your staff are actually trained in how to appropriately, I should say, use the PPE and the RPE. Thank you.
Good morning. My name is Cecilia Edith Ali, and I own a flower shop, and we also have a vegetable and meat shop. I thought I heard last night, and perhaps the others could also correct me if it's not correct. I thought I heard an announcement from the government of Barbados yesterday saying that they were putting fluoridation into the water system. Am I the only person who heard that? The chlorine, yes, yeah. But it wasn't clear how that is, or if that was part of the fight against the spread, or this was something else.
I cannot answer what the government of Barbados officials said in that particular press conference, or I was not part of that. However, what I can tell you is that water has to be clean and then safe. So chlorination of drinking water is the standard practice in this country and everywhere. So that could have been said in that press conference. I cannot comment on those issues. On the other hand, when you have hand washing, you have to use clean water. So water has to be clean as much as possible to ensure that your hands are clean as well.
Hi, good morning, everybody. My name is Carol Angola. I'm from Halton Graphics, which is a small commercial printery. We've had meetings with our staff, and we've gone through most of the issues that you've spoken of. But one of the questions that came up from them was related to what do we do if someone comes down with the virus. And I wanted to know if there were steps that small businesses should take. Obviously, we know they isolate the individual and you contact the relevant health authorities and stuff, but what are the next steps with reference to other staff members? Do they themselves have to look at self-quarantine? Do we wait and watch for 2 weeks? If you could provide some guidance.
Okay, that's a wonderful question. For the first thing, we have to look at what would be the officials, the Ministry of Health officials would be doing. Immediately, once they have identified a case, they have the protocol to follow, including to look for the contacts, where the person working and who are the first immediate circle, and they go with those ones. Therefore, you will be notified, you will be contacted by them, whether you have to be quarantined or you have to come in for testing. That will be determined by the health officials. Currently, they are working any suspected cases, and then they follow the person. If there is a need to quarantine the person, they may take those actions. So this will be for the next few months like that. Down the road, when if we have more cases, there will be a change in the policies, how they're gonna, because the manpower will be too much, there will be demand in the human resources, therefore they may take different actions. So currently, they would, if there is any suspected case and if that person is taken and then isolated, the contacts will be also traced by the Ministry of Health officials.
Before we get to the next question, a quick thought. Following on from that question, I'm of the view that individual business owners need also to put in place some critical policies at this time to help manage their firms. Whereas the governmental authorities would have identified 3 stages and the attendant protocols for each stage, we also have to employ our own policies to help protect our employees. We are at stage 1 in Barbados, as we know. It is not until you get to stage 3, if you get there, God forbid, but if you do get to stage 3, the issue, for example, of medical leave kicks in because you're in a state of emergency and employees will be able to access between 5 to 7 days paid sick days. As we know, the law now is 3. So you'll be allowed to access up to 7 days if we get to that stage based on the national protocols. But within our individual firms, like I would have in my own staff meeting here, indicated to the team, if you experience any of these symptoms whatsoever, do not come to work. Do not come to work. I actually heard one of my officers coughing the other day. Yesterday I went, you understand, I went to them just to make sure. But you know, seriously, I think that these are things that we have to do as employers, as owners, as managers, all right? Because this is a unique case, as you rightly said. So I think that maybe relaxing the rules a little bit at this time. I know there are those who will fear that persons will abuse the situation, but I'm satisfied right now that we can believe in our teams, we can believe in our employees to do the right thing. And so if it is that at our firm level, we can look to some of these policies, I think these will help. Giving employees the permission to take that day, take a couple of days if they begin to feel any of these symptoms and know that they will not be penalized. Again, a travel policy can be introduced for those who have employees that travel. I know some of the big firms are doing it. We small firms have to do it as well. And that is those who may have recently traveled, you know, that they go immediately into some sort of self-isolation process, that they self-quarantine, you know, during that period if they travel. Some of the big firms have put these policies in place. So I think that these are things that we can do on our own, even you know, as we wait to see what the national protocols will be as the stages progress. So at the firm level, give the employees of the view that latitude, that they can take a day, they can take 2 days if they begin to feel some of these symptoms, and that they don't have the fear of losing you know, revenue, remuneration, and or their job as a result. These are things that we ought to do, I think, at the firm level. So we have another question here, and then we'll come back to you, Don.
Yeah, may I add something to that? I have already mentioned that prepare your customer and then your business by having a business plan. For instance, in our office, I have the business continuity plan. We also do teleworking. Companies like you definitely could also work from home, given you have the necessary support and equipment. One thing is that when you ask that question, what I can do, definitely you have your own plan. However, when it comes to the contact tracing and things like that, it is officials' responsibility. But I fully agree with the Senator and the CEO comments. Each one of you, if you are able to make even a 1-pager or 2-pager plan or policy for your workplace, that would be wonderful. I shared with your office what we prepared for workplace, so you can consult some of the information already I have shared with you. So you can send them by email, you can have that access. Somebody, please.
Hi, my name is Wayne Eiffel. I'm into manufacturing, and I represent Antiphilus Belgian barbecue sauce. The thing is that not only is the manufacturing part of it I'm asking about, but also I do food, and food handling seems to be something that will play a very integral part when it comes to the COVID-19. My question is then, how do we reduce the paranoia? Barbados is a very small society. People know each other. Sometimes you don't have any symptoms of any flus or cough, but sometimes we have what people say, some saliva right down the wrong hole, and you start to cough. Sometimes there are things in the atmosphere that might cause you to sneeze. And then people start then to build a rumor, as you mentioned, that the person down the road, like they say, like they got the COVID-19. That will affect and impact a business like mine. How do we reduce the paranoia of our people? Also, a lady in the audience here, she wants to know what about people who have high blood pressure, and if it is possible that if they have blood clots, if things like vitamin C and boosting the immune system, how can she deal with that? So that's a question for a person in the audience as well. Thank you. And thank you for inviting me, and thank you for the advice that you've provided this morning. Thank you.
Thank you very much for that question and comments. I will also ask the Senator, as the expertise in those areas, to answer you, especially on the rumors and others. The first thing is about manufacturing and food handling. We have to continue the best practice. The HACCP method, the critical stages what you do for food handling, that has to be continued. Critical points of services you may have from the time it is prepared, the time the customer is receiving such a food. The point is not about your work. It is the point how the customer would see it, and then how you can reduce this impact it may have in your business. So, again, prepare your customer. That is also in your hands. From our side, we're going to educate the public. Everybody has to do from their parts. Ministry of Health will continue. The Small Business Association will continue to educate the public about these things. The more we put information out there, the less the rumors and the fake news will be drowning our messages. So the right messages, look at that poster we put out there for this morning. So we have those kind of messages to reach everybody. There are jingles, there are on radios, on TV, it's going on right now. So people have to be receiving those messages from your personal perspective. So you cannot reach 50,000, 15,000 people. You may have certain number of customers. But can you do something, a little change in your, whether you are giving a receipt or whatever you are doing, just a small message. We prepare the same food the same way. Okay, we don't, the same food, if it is whatever your products is, it has not changed. So we are the same people to trust your services to continue. I'm not a business person, but I'm just advising from the public health point of view to make sure and to reach out. From our side, we advise people don't eat certain foods which will be contaminated or something like that, raw versus cooked. We have the 5 essential ways of how food to be prepared. So we provide those information. Thanks for bringing it up. We're going to continue to advocate on those things. The high blood pressure and anything, individuals with chronic diseases, high blood pressure, heart disease, cancer treatment, or diabetes, they have to continue the way how they are managing the current illness they have. They don't have to change anything extra. However, you have to be in the right direction when you are managing. It's not something you take medication today and then you feel better and then tomorrow you don't take. You have to be continuously taking your medication as prescribed by your physician. That is the first thing. The second thing is that individuals who may have high blood pressure and then they are also in lifestyle changes, reducing fatty foods or salty foods and others, they have to continue to do those kind of things, or not to drink alcohol or any other things relating to their high blood pressure. So the next step is that if the individual is already controlled, the likelihood of severity and chronicity will be reduced. That's the one thing. And then the individual have to continue to protect himself or herself from COVID by practicing respiratory hygiene and hand hygiene, and then avoiding contact with sick people. It's very important that individuals, when they are sick, especially with respiratory illness, should not come to the workplace. Should not come to workplace, and then the employers and have to also accommodate, and the mechanisms have to be created. I know for sure it is not an easy issue. It was in the newspaper front page today. Who's going to give the sick certificate, and then how the person will be paid. All those issues are there. However, you have to encourage your own employees not to come to work, because you lose 2 more persons, especially with this influenza. Influenza is more contagious than COVID. But the same thing, COVID also do have higher rate of transmission and then attack rate, which we don't have the clear data at this point in time. All right.
Dr. Donna, again, the Ministry of Health has created a hotline. The number is 536-4500. So in response to the lady in the back, her question, if you have a sick employee, let them stay at home. If you have any queries, you call the COVID-19 Ministry of Health hotline, 536-4500. And if that person is suspected of having COVID-19, then the Ministry of Health, they have doctors that will come into that patient's home and assess the patient to figure out if they are at risk, not at risk, but if they are indeed possible COVID-19, and then they will take the necessary precautions in terms of getting them tested, getting them quarantined, getting them treated. But just to reiterate what you said, doctor, if you let that person come into your organization and you have a staff of 4 or 5, they can come if they are indeed COVID positive and spread now to your other staff members. So now you have a bigger issue on your hand and your other customers. So you have a bigger issue. So in terms of preventing the spread, let them stay at home. Barbados, the BAMP, which is Barbados Association of Medical Practitioners, we've been discussing that and discussing ways in which we will work at it from an NIS perspective, because before we had 3 days, but now we are allowing 5 to 7 days, as the senator said, because of this whole thing. Somebody else, 536-5400, 536-5400. Sorry. All right, I mixed. Sorry, 536-4500. 536-4500. Thank you.
Hi everyone, Graham Bell from Battalion Security. My question is related to the shortage or the inavailability of hand sanitizer and certain products around the island. What are alternative products that can be used? And what are the active ingredients that we should be looking for in these products? Even if we're making them at home, or if we're looking for them from on the shelf, or if we're looking for natural products that have naturally created, what are the active ingredients that we should be looking for in these products, and in what concentrations?
It's a very good and tough question. Yes, I cannot tell you exactly in terms of the when you're gonna get the supplies. My understanding is that the retailers and others said they're gonna get more supplies and it will be available in the country. However, I don't encourage anyone to start to have at home production of those hand sanitizers, because you may end up also having some infections, other bacterial infections, if it's not properly produced. We have the ingredients. If you have a company which is interested to develop and then commercially produce in this country, we are happy to provide you. We have the information. We can give you the ingredients, how to prepare it. It is just a very simple thing, glycol, glycerin, alcohol, and other components to be used to make it a gel, the hand sanitizers. And then the alcohol composition for this COVID and other viruses have to be over 65. For COVID, it's about 70% alcohol composition in the hand sanitizer. So you have to know exactly how it is to be made, and then the facility you may have, so that it will be not contaminated with other pathogens, and then you have to provide the appropriate product. What is if you don't have those facilities at home, at your workplace, as I mentioned, the most important way is to wash your hands with soap and water. For now, we have soap and water. For the disinfection, hypochlorite, the so-called household bleach, that could be also with a concentration 0.5%. That could be you can use to disinfect surfaces. So that's what I can tell you at this point in time. But for the hand sanitation, if you don't have the hand sanitizers, use soap and water. It kills the virus and other pathogens. One in nine, yes. Water.
Okay, there are no additional questions. A round of applause again.
Thank you.
Thank you so much. That was very informative, very instructive. I particularly like the dialogue that followed. I want just in closing to reiterate a few thoughts for you. The call for specific businesses that are what I call an occupational risk, for us to come back in and to treat to this specifically. We will pursue that as early as next week, depending on your availability, Doctor. And we'll identify all of our cleaning firms and those that may be Dr. Matthews and the medical fraternity within the membership and the wider sector, and others that are at what we consider to be an occupational risk, because you want to make sure that you, when you have to go into those firms, and some of you have residences as your clients, and you have to clean, that you are well armed, well prepared, understand how to do so, safely protecting yourselves, first of all, and by extension, those whom you serve. So we will definitely follow up with that, and I'll talk to Dr. Gabriel about that, and see if we can get a date for you as early as next week. As you know, Barbados is at stage 1, and based on the science which we went through today, that can quickly move, and so we want to do all we can to keep it, to keep that spread at a minimum, and it is really dependent, I think, a lot on us and what we do in terms of our behaviors. Yes? For the question about food, that's a rather interesting question. I'm of the view that we may have to enhance our marketing a little bit. I took note that Dr. Gabriel mentioned when he came in, he saw our little posters and so on. Interesting, because that is a part of our own strategy. So here it is, when you come into the office, we have all these posters across, you know, the lobby and the walls and the restrooms and so on. And why? To serve as a reminder, yes, to those who will use the facility of what we ought to do, but also to let you know when you come in that we are conscious of this situation, and we too are playing our part in trying to provide a safe environment for you when you come to the facility. We have training on evenings and all that. Immediately after this session, for example, staff will sanitize this room in preparation for the class that we will have a little later on. So enhancing those little tidbits in your restaurant, for example, if you can put your posters or your signs up and let your customers know that you too are paying attention and you too are doing what you can in a preventative way to enhance the sanitation of your facility. These are things that will help to dispel rumor, but also to build confidence in your customers and staff that it is a safe environment. So these are things that you ought to do. Okay? And thirdly, I want to remind us about the acronym we heard today. I like it. I love it, actually. Dr. Donna, Catherine, I know y'all are always on social media. Help us to tweet this stuff and get it out there. Clean. Have a graphic. Clean. C. Clean your hands. O. Off from gatherings. Alright, as you know, we are at stage 1, so gatherings over 100 persons have been restricted. Good? R. Raise your immunity. So take care of yourself. Eat the appropriate foods, take your vitamins, take care of yourself to boost and build your immunity. The next O. Only sick people wear masks, and I particularly like that point because we know for a fact we walk around and we see people all over the place, all through airports and wherever it is with the mask. So with the exception of those that have to do that as a part of their job, you heard today, with the exception of those, the others, you're giving yourself a false hope. Because unless you are sick, because the mask is ready for you if you are sick, that you're using the mask to prevent the spread of the virus, isn't it? All right, and then the next letter, the N, no handshakes. So if you can practice that from here on in, no handshakes. Don't shake anyone's hand, right? Let's begin to practice that now. And then the A, avoid rumors. Lots of rumors are being spread, and you expect that when, I hear people with things that you say to folks, let us not get too carried away. You expect that. Why? This is new, as we heard before. Yes, coronavirus has been around for a while, but COVID-19, this particular aspect of it, this strain is new. So people will be unsure, will be uncertain. There's a heightened fear and insecurity. And I'm of the view that you can only dispel that with information, with teaching, with facts. All right? So let us get on that train and spread the truth. All right? Let's spread the truth. The COVID-19 is spread by those droplets that come as a result when you sneeze, when you cough, and so on. So you want to be mindful of that. Don't cough clearly out in the atmosphere. If you use tissue, discard it. If you don't have tissue, you're going to sneeze in your elbow as much as you can. Right? Let's begin to practice these things. I'm reminded of what our parents told us when we were growing up. You realize that? You realize that the most safe way really is washing your hands with soap and water. Isn't that what our parents used to tell us growing up? You wash your hands when you come from playing outside. You wash your hands. Go and wash your hands before you sit down to eat. Go and wash your hands. You come in the bathroom. Did you wash your hands? Simple hygiene. Can you imagine that years and years after we are brought back here now with a virus that is reminding us of basic hygiene. And I'm saying that if we begin to practice this, ladies and gentlemen, let's begin to practice this some more, because yes, we've been doing it, let's do it some more. I'm of the view that based on the data we saw, the bar charts earlier, we saw the spike in China, and now today we heard the data that at March 19th, there were no new cases in China. They spiked, but they quickly arrested the matter, quickly put systems in place to avoid the spread, and so they have no new cases in China. Yes, they may have imported ones, and maybe that's what they're managing now, but no new cases in terms of human-to-human transmission on either. And so the possibilities are there for us also to treat to this here in Barbados, and I like the point about the region, because we have family across the Caribbean. Yes, some of us have to do business and so on across the region, and so for us it goes beyond just Barbados. It is also the region. So I want to thank you so much for coming out today and sharing a bit of your morning with us. We have some factoids that we're going to send out. We've sent out some in the email blast. We have some more. We got some from PAHO. We're very thankful. We'll send those out as reminders to you again. And please remember the hotline, 536-4500. I know people have been calling and they're saying it's busy. Yeah. But that's what you would expect with a hotline, when lots of people are calling it, right? So you keep calling. You keep calling and so on, okay? But remember, we are only at stage 1, and we pray to God that we don't go any further, that we can arrest it. But even if we do, there are protocols in place that we're inviting all of our citizens to help us to follow, that we can curb this thing and prevent the spread here in Barbados. So once again, ladies and gentlemen, I want to thank you so much for coming. I thank Dr. Eustanis Gieber, yes, the representative from PAHO WHO here in Barbados, and his team for coming and sharing with us today, and the information that has been provided that we will upload on our website, Facebook page, and so on, and share with you, that you can also share with your team. And I thank my team as well for the work done in coordinating our event today. We thank the technical team, yes, David and Dylan, 2Ds, David and Dylan, for ensuring that those who couldn't get here today were able to watch online. We thank our Facebook friends and followers for being with us today. I'm going to ask you when you get home to go online, watch it, share it, and let us get the message across to as many persons as possible. So thank you once again. God bless you all and have a good morning.